My topic is concerning sepsis. What is sepsis and knowing when to seek help? The learning objectives for this PowerPoint presentation are to define what is sepsis, to know the at-risk populations for sepsis, to identify the signs and symptoms of sepsis, and to be able to explain the preventive measures for sepsis. First, we're going to do a pretest. If you can answer these questions in the beginning correctly, maybe you know just a little bit about sepsis, and then we'll do a post-test at the end of the presentation. So question 1, who is most at risk for sepsis? Question 2, how is sepsis acquired? Question 3, can sepsis be fatal? Question 4, name preventive measures to help avoid sepsis. And question 5, what is the death rate in hospitals each year from sepsis? Okay, so what is sepsis? Sepsis is a toxic inflammatory response to infection in the body that affects the organs and tissues. It can cause tissue and organ failure and even be fatal if not treated in a timely manner. Sepsis can be caused by any infection, whether bacterial, viral, fungal, or parasitic. Examples are urinary tract infections or UTIs, skin infections like MRSA or MRSA, or a gut infection like Helicobacter pylori or H. pylori. Sepsis is not diagnosed based off of infection alone. Other factors include if the person has more than one symptom, along with being in a high-risk group. The physician will more than likely suspect sepsis in this case. Sepsis kills about 270 Americans in the United States each year, which equates to about 1 in 3 hospital deaths. At-risk groups. There are several populations at risk for developing sepsis: the very young, the elderly, the immunocompromised, individuals with chronic illnesses such as diabetes, kidney disease, lung disease, and cancer. Signs and symptoms. The acronym TIME is used for knowing when to seek help in the elderly and individuals with chronic illnesses. T stands for temperature, which is higher or lower than normal. I is for infection, which may be present with signs and symptoms of an infection in the individual. M stands for mental decline, whether the patient is confused, sleepy, or difficult to arouse. E stands for extremely ill, having severe pain or discomfort, or the person may say, "I feel like I might die." When these signs are evident, it is time to seek help, get to the nearest hospital, and/or call 911. Keep calm and think sepsis 6. Signs and symptoms in children. In younger children, the signs are very different. So any child who feels abnormally cold to touch, looks molted, bluish, or has very pale skin, has a rash that does not fade when you press it, is breathing very fast, has a convulsion, or is very lethargic or difficult to wake. But there are other signs in children under 5 that you should be aware of, which are if he or she is not eating, is vomiting repeatedly, or has not urinated in the past 12 hours. If you recognize any of these signs, please contact the physician immediately or call 911, because the child may be critically ill. Sepsis prevention. Tackling sepsis prevention is done by practicing consistent hygiene and by avoiding individuals with infections. Getting vaccinated is also a good way to prevent infections like influenza and pneumonia, especially in older and chronically ill patients. This also applies to younger children being vaccinated to prevent infections. Taking the prescribed medications like antibiotics for the infection for the duration noted is another way to prevent developing sepsis. Always remember, hand washing is the best method for practicing good hygiene as well as preventing the spread of disease. Now the post-test questions and answers. So number 1, who is most at risk for sepsis? A, African Americans, B, the elderly, younger children, the immunocompromised, or the chronically ill. C, adults between 25 to 45 years old. The answer is B, the elderly, younger children, the immunocompromised, or the chronically ill. Question 2. How is sepsis acquired? A, from an infection left untreated. B, it's inherited. Or C, through a blood transfusion. The answer is A, from an infection left untreated. Question 3. Can sepsis be fatal? A, true, or B, false? The answer is A. Question 4. Name the preventive measures taken to avoid sepsis. You have hand washing, vaccinations, being treated quickly, and taking antibiotic medications. Question 5. What is the death rate each year in hospitals from sepsis? A, about 10,000, B, about 500,000, C, about 300,000, or D, about 100,000. The answer is C, about 300,000. References. To further educate yourself about sepsis, you can log on to the internet under www.cdc.org/sepsis, or you can go to the actual sepsis website, which is www.sepsis.org, to find out more about this life-threatening emergency.